Hello, and welcome to the next panel for the VegFest UK Online January 31st, 2021 sessions. Here we are, right in the middle of another lockdown, and we are this time joined by the esteemed and very valuable plant-based health professionals UK. We have a panel of practicing GPs, doctors, researchers, and such like, who are involved with the cutting edge of everything that's coming out of plant-based health and nutrition. And this is going to be a panel where we're looking at why health professionals should be really giving concern for animal rights. So that's a really interesting panel. And once again, we're headed up by Leila Dehghan. I'm very, very grateful for Leila's work. Leila has a fantastic contribution to the plant-based health professionals UK generally, but also in a presence on Facebook more and more. We're seeing Leila, a really, really valuable contribution. So welcome, Leila. Thank you for joining us. It's a pleasure to have you with us again. And we seem to share some great platforms. I know I always mention how we joined at VegFest Morocco last year. I'm thrilled to say that we have Sim Mohammed from VegFest Morocco joining us tomorrow on Sunday for an update, hopefully on plans for VegFest Morocco this year. But it's just great for you to join us again. Thank you so much for not only giving up the time to join us today for free, but also for all the work you do. It's just so valuable. I was just mentioning to your panel how valuable the contribution of the plant-based health professionals UK is right now. And of course, too, about the brilliant news of the recent launch just this last week of the plant-based health online service, which I know that one of our panelists is a leading part of, but of course has the support of the whole group. So Leila, thanks for joining us. And I know you're going to introduce the panel and everything. Just briefly tell us, what is this panel going to be looking at today?
Thank you, Tim. I really appreciate it. We at Plant-Based Health Professionals UK are really grateful to VegFest and to you, for welcoming us here and offering us a platform. So today we are going to talk about, why healthcare professionals should actually care about animal rights. And this is a topic which is really close to my heart. But I want first to introduce our amazing panelists. So actually they introduce themselves. And we do that usually in alphabetical order. So we start with Dr. Aysha Akhtar.
Figures I would be first. I'm always first in classrooms whenever there's something involved, question and answer period. It was always my bad luck. But anyway, no, I'm happy to introduce myself. Thank you so much for having me part of this panel. My name is Aysha Akhtar. I'm a neurologist and public health specialist. I'm currently the president and CEO of the Center for Contemporary Sciences, which is working to replace the use of animals in medical experimentation with much more effective testing methods that are based on human biology. Makes sense, right? But I've also had a long line of experience working in the public health area. I was with the Food and Drug Administration and the Office of Counterterrorism and Emerging Threats, preparing for pandemics such as this. So this is everything that we're going to be talking about here today is very near and dear to my heart.
Thank you. That's amazing. Next is Buvana, Dr. Buvana.
Hi, I'm Buvana Dwarakanathan, and I'm glad to be here. I look after critically ill children. I'm a pediatric intensivist in London, and pediatric nutrition is very, very dear to my heart. And more so plant-based nutrition. There's very little out there, and we're all learning as well. And today I'm going to talk about a topic which is very passionate. I'm very passionate about.
Thank you, Buvana. And next is Dr. Hayley Tait.
Good afternoon. Delighted to be here. I'm Hayley Tait. I'm a GP based in Liverpool. I'm a vegan and I advocate a whole food plant-based diet for health in my practice. And yeah, I'm delighted to speak on for animal rights and why healthcare professionals are in a great position to advocate for animal rights.
Thank you, Hayley. Laura, Dr. Laura Freeman. Here she is. You need to
Oh, sorry. Thanks, Leila, and thanks also to Tim and Pete for the really nice introduction. So I'm a GP and lifestyle medicine doctor, but I'm also really excited to be speaking today in my role as co-founder and medical director for Plant-Based Health Online. I've been using plant-based nutrition with my patients for almost 5 years now. And today I'll be talking about why we should be leading the way as healthcare professionals, especially when we think about antibiotic resistance.
Thank you, Laura. Rosie?
Hello. Hi, I'm Rosie. I'm a former zoologist and former ecologist, and spent a couple of years researching captive animal behaviour, particularly human-animal interactions. So this really opened my eyes to the issues involved in production of animal products, and I naturally went vegan following that, and became fascinated in the impact of plant-based nutrition on human health, and trained as a dietitian. So now I work to promote the benefits of sustainable and ethical and well-balanced plant-based diets through both my NHS and my private work and my freelance jobs. So yeah, thank you for inviting me.
Thank you for being here. And Simon, Dr. Simon. I think it's Simon Chappell, if I'm right. Yes.
That's right. Hi, Leila. Hi, everybody. Thank you so much for having me on the panel today. My name is Dr. Simon Chappell. I'm a GP and lifestyle medicine enthusiast down in the southwest of England, rural North Devon. I'm a family GP, family doctor, as I said, serving a largely farming community, mainly livestock, and thought I would have a go at tackling some of the psychological aspects and mental health issues surrounding animal agriculture and that industry. So I hope you can stay awake till to listen to me at the end. Thank you.
Thank you, Simon. Thank you, everybody. And thank you, everybody who's actually joining us on this Saturday. I mean, it is cloudy and rainy here in London. I don't know how it is where you are. And we have the comment section. So feel free to write in the chat if you have any questions, or even if you have just any comments, please write them there. And if you have any questions, I'll make sure that I'll ask them towards the end. So, I was a doctor for a long time. I was training to become a pediatrician. And as doctors, we are actually very aware that the environment plays a role in being and staying healthy. We know, for example, if there is air pollution, people with heart or lung disease, or the elderly, or very young children, they can have problems, they can suffer as a result, and their condition can get worse. So nobody would actually argue that the climate change and the extreme temperatures that we have been experiencing, they're affecting human health. But what about animals' well-being? And obviously, we all agree animals are sentient beings. And as Dr. Katz said in a recent webinar, he said that no decent person wants suffering on their plate. But we are not actually here to discuss whether we should actually harm animals. It is about the way we treat the animals, how that is actually directly kind of affecting human health. And I think we should really start where we are right now, with this current pandemic, the COVID-19 pandemic, and how we actually ended up here. Aysha, do you want to talk more, tell us a little bit more about that?
Sure. So, yeah, this is a pandemic that actually quite a number of people had predicted. Many of us knew that this is going to come, and many of us knew that this was going to come in large part because of the way we treat animals. And so what we suspect with this pandemic is that it stemmed from, that the coronavirus was originally carried by fruit bats, which carry a lot of different viruses. They're natural carriers of a lot of viruses, but they don't get sick from the viruses, they just carry them. And what we suspect is that at some point in the wildlife trade, and the end result is the wet markets, or the live animal markets in China. Sorry, that was my cat that just walked by. That's one end result. We suspect that at some point during wildlife trade, the coronavirus passed from fruit bats onto perhaps another animal like the pangolin, which are these type of scaly ant eaters, and then ultimately onto humans. Now, we saw this happen with SARS more than a decade ago as well, severe acute respiratory syndrome. That happened in 2003 in China in very much the same way as this coronavirus occurred. That is also a coronavirus. We've seen multiple new viruses emerge from the different animal industries, from the camel industry. We've got the Middle Eastern respiratory syndrome, which is another type of virus. We've got a Hendra virus that came out from Australia. We know about Ebola, of course, and Ebola is very much linked to the trade and the capture and killing of animals in the African bush. And non-human primates play a key role there. We know about HIV, which came from the bushmeat trade as well, and our killing of animals there, and particularly non-human primates. What we've been seeing is a greater emergence of new viruses coming out. And we can break down the reasons why we are seeing this greater emergence of new viruses. One, of course, is there's a huge human overpopulation, right? So we are spread throughout the globe, and there are way too many of us. And when there are way too many of us, we're living in closer quarters, and it's very easy for us to pass infection onto each other. Two, we are traveling more than ever before. And that's why I think a lot of people and public health experts were taken by surprise just how much of travel can play a role in transferring one virus to another part of the world. And that's what we saw with this pandemic. Three is the wildlife trade, which I mentioned. And here, every country is involved in the wildlife trade. And I would say that Europe and the US are among the largest importers and exporters of wild animals. And in the wildlife trade, animals are shipped, trapped, killed, used as exotic pets, to stock zoos and circuses, to stock laboratories for experimentation, to be used as ornamental objects for their fur and skins, you name it. That's a huge disruptor of the eco-balance, and that is causing us to be closer and closer to many different types of animals. And the conditions in the wildlife trade also make it incredibly easy for a virus to pass from one animal onto another. And then the last two reasons why we're seeing an emergence in new viruses is climate change. And climate change disrupts ecosystems. It actually makes it easier, especially for mosquito-borne viruses to emerge. And so we saw that with the Zika virus, for example. But another virus, another type of factor that's playing a key role in the emergence of new viruses, which still is not getting the attention that it should, are factory farming. It's factory farming. And we have seen rapid and just amazing, in a bad way, mutations of the influenza viruses coming out of factory farms. And we all know about the many different types of bird flus and swine flus that are sweeping across factory farms throughout the globe. What people don't realize, I think, is that how much of a risk that poses to human health as well, because these influenza viruses can be incredibly deadly. They're the type of viruses that can be one that can not only be very lethal, but can spread very easily among people. Now, we've been really lucky so far in that there has not been an influenza virus that has emerged in recent times from factory farm that has caused problems for us, but it is just a matter of time. And so ultimately, what all this suggests is that it is in large part the way we treat other animals. And this gets back to what you were talking about, Leila, about human health is very much integrated with animal protection and how we treat animals. The way we treat animals has very much a direct role in our own health. And so unless we drastically shut down these industries and curtail these industries, we are going to see many more infectious diseases emerge at an even faster rate. And I hate to say this, but this pandemic is light. As hard as it is light compared to what the next pandemic can be. Right now, the lethality rate is between 2 to 3%, meaning 2 to 3% of of people who get the virus will die from it. But if you look at the SARS virus from 2003, the lethality rate was 60, or it was close to 40 or 50%. If you look at H5N1, which was a bird flu that emerged more than a decade ago, that lethality rate was 60%, meaning 60% of the people who got that virus died from it. So as bad as this pandemic is, we're likely to get one that's going to be much worse unless we drastically change how we think about animals and how we treat other animals.
Thank you. That is actually very shocking when you hear about it. And I did a bit of research myself, and there are actually over 150, the so-called zoonotic diseases, isn't it? It's shocking. And I'm glad actually you mentioned factory farming, because a lot of people say, okay, so let's leave wildlife, wild animals alone, then we'll be fine. But it is not just that, even factory farming, causes health problems. And Laura, you wanted to talk to us a little bit about that, one of the problems factory farming, we see.
Well, I mean, really, I had kind of focused on the use of antibiotics in animals and why we need to care about that as healthcare practitioners, or actually as anybody, no matter what our background is really, but why we should be increasing awareness of it amongst our colleagues and patients as healthcare professionals. Because antibiotics are such a crucial component of modern medicine. Since we discovered penicillin, nearly 90 or just over 90 years ago, we have actually made huge advances in preventing and treating infection and with routine surgery, for example. But now we're seeing huge problems with resistance, which is what happens when bacteria evolves so that it becomes less susceptible to the treatments, to the antibiotics that we have. And this means that they're no longer as effective as they need to be, and that infections can spread much more easily. So I think it's important to say that resistance has occurred naturally in the environment for millennia, actually, but it's the way we are using them now, or overusing them or misusing them, that's really driving this problem with resistance just now. And I'm not just referring to how we use them in humans. It's just, as you said, Leila, it's the widespread use of antibiotics used in animal agriculture that is often not known about and not discussed about often enough, which is why I want to talk about it just now. And although there's some variance from country to country, it's thought that between 40 and 70% of antibiotics sold globally are actually used for animals. And so the problems that these creating are not hypothetical problems for the future. They're problems for us just now. We're already seeing that some cases of tuberculosis and gonorrhea, which is a sexually transmitted infection, are now not responding to last resort antibiotics. We also know that around 700,000 people lose their lives every year to antibiotic resistance. And it's thought that if we don't take action, this figure can actually increase to a staggering 10 million lives lost per year globally, which sounds like an awful lot, and of course it is, but to help put that into perspective, it translates into a number that surpasses all cancer deaths per year globally. And this also has huge financial implications. It's projected that this would have a cumulative cost of $11 trillion, and the World Bank estimates it would force 28 million people into extreme poverty. So it's a really significant problem. The other problem is that no new classes of antibiotics have been developed since the 1980s. And although there's so many challenges in the development of new drugs, and I don't pretend to know that much about it, but I do know that pharmaceutical companies are not so invested in spending millions of pounds on developing new antibiotics that need to be used sparingly. So that's another huge problem. The other thing is that it's not just a problem for us here in the UK, it is a problem for us across the world. And although practices vary from country to country, I think it's important when we talk about it that we need to think about our actions here at home, but also about how they translate globally. They recently this week gave a talk on plant-based diets and their sustainability, and somebody in the audience called me out for using global statistics and not making it specific to the UK. But I really have to stress that again, this is a problem for us all collectively and not just here in the UK. It's true that low and middle income countries will suffer more severely, but I think that we also need to realise that here in the UK, we shouldn't feel immune to these problems. People here will suffer with longer, more severe infections. There'll be increased number of deaths from infections that we no longer have effective treatments for. And we know that by 2030, the use of antibiotics is going to increase more than 30%. Or if we don't make changes, these numbers are projected to increase to even up to 200%. So it's really quite shocking. But like I mentioned before, the misuse and overprescribing in humans does have a really important impact. But it's really that antibiotics in agriculture, which is the missing piece of the conversation that we don't talk about with our patients. And this really comes down to our increasing demand for meat and how this translates into increasing use of antibiotics in animals. And again, this is seen especially in low to middle income countries such as Brazil and India and China. And these antibiotics are given to animals to treat infections, but also given prophylactically, which means to prevent infections because they're often kept in such dire conditions. And in some countries, antibiotics are still given as growth promoters, so to reduce time to slaughter. And this really has a direct impact on human health and human antibiotic resistance in a couple of ways. So in direct ways, direct contact, so from farmers and from vets, but also for the wider population who are preparing meat or consuming animal products. And so I think it's really important that people realise that. In the UK here, there has been some reduction in the use of antibiotics in animal agriculture, but if you read the government reports, there's still lots of progress to make in order to meet the targets that were set. So I'm looking up here because I had written down a quote from the government's report in their 20-year antibiotic resistance vision. And they said that untreatable infections in animals threaten sustainable food production in growing populations. Well, we know that our current food system is completely unsustainable anyway already. In fact, that's a whole different talk in itself, I think. But reducing our demand for meat and shifting towards a whole food plant-based diet as a way to tackle this has got to be part of the conversation and really part of the solution. I think it's also worth noting that foodborne illnesses such as Salmonella, E. coli, Campylobacter are most often traced back to contaminated animal products. And these are infections that require antibiotics themselves. So it's just a kind of vicious circle. Then if we come back to the topic that we're supposed to be discussing today about whether healthcare practitioners should care about animal rights, well, it's got to be yes. And I think this topic of antibiotic resistance really has to hold high priority in our conversation with our patients about it, because it gives us such a good opportunity to talk to them about it. And I really feel like it's something that patients can understand and relate to. So normally when I talk to people about reducing their animal products, it's to help them think about how to reduce the risk of heart disease or diabetes, for example. But with this, I feel like it applies to everybody because everybody at some point has been to their doctor to have antibiotics for a chest infection or a sinus infection, for example. And so they understand the impact that and how, prescription needs to work for them and that a problem and the consequences if it doesn't. And GPs are already having this conversation with their patients. So if they're presenting with a virus, for example, then GPs, have a kind of script that they use to tell them about the problems of antibiotic resistance. But I would suggest that we just need to extend that conversation a bit further and include, why our food choices are so important and just help people make that connection. If we take it even further, we know that whole food plant-based diet has such a crucial part in our immune system and makes us less susceptible to infections generally. So I think it's just a really good opportunity for healthcare practitioners to include this when they see their patients.
Thank you, Laura. Yes, it is interesting you say that in the UK, the use of antibiotics in animal agriculture, they say they have reduced it. And because one of the arguments I hear is that, what about organic meat? And although organic means that less antibiotics is being used, but there is still, antibiotic use. Having said that, eating meat comes with its own health problems, doesn't it, Hayley? You have to, yeah.
Yes, it does. I'll unmute. Absolutely, yeah. You know, and I'm going to talk about that now. I think it's important to say that as healthcare professionals, you know, we lead with compassion and we don't discriminate. We took the oaths of non-maleficence and beneficence, and we're the advocates for patients' rights to health and justice in the delivery of health. And certainly there's no place for us to be condoning eating animal products when all the evidence says that this is detrimental for our health. At the moment, as healthcare professionals, we're like a firefighting a sick society instead of creating a well society. And what we should be doing really is educating and empowering our population so that, you know, that they have the tools themselves to be living a healthful life without animals in. In terms of animals, we know that the big causes of death and the impact on quality of life are all from the non-communicable diseases. So as a direct negative effect of eating a plant-based diet. So we can't support the use of animals in this as a massive industry, because it's driving the explosions in numbers of patients with the #1 killer of cardiovascular disease, mainly due to atherosclerosis from saturated fat. Obesity is a big impact on our healthcare service, with the impact on that directly from obesity on sort of joint problems, but also leading into type 2 diabetes. And the alarming cancers that we get. And we know that there are, you know, so processed meats have been classed by the WHO as a class 1 carcinogen, and red meat as a 2A with a probable cause of cancer. So the impacts of meat we know are detrimental, and yet still we've got a food system which has an enormous amount of ultra processed food. I mean, following your heart attack, you'll look at the hospital menu and you'll get a diet rich in saturated fat, salt, sugar, and all the driving factors that actually put you in that bed, rather than the healthful benefits and the solutions to the problem, which are around a whole food, plant-based diet. But we have got that flip side. So we've got the proactive preventative measures, we've got the lifestyle medicine, and one of those arms of that is the whole food plant-based diet. So this should be our primary prescription as healthcare professionals. And you know, this diet is naturally rich in antioxidants and anti-inflammatories, and you know, not only is healthful, but is also can reverse as well as prevent disease. I think there are other indirect impacts as well of using animals. So the impact on our health, we've got resulting from consuming animal products as well, but in terms of pollution, so the increase in agriculture that's driving this food system is increase in agricultural runoff. So then that's impacting on our soils and impacting on our water. This sort of makes the food that we are eating even less nutritious than it could be if we didn't utilize all our land for animal agriculture. We know with the recent case with Ella Casey Deborah with severe asthma, and one of the causal factors was air pollution, and that was predominantly nitrous oxides. Again, that's comes from the animal agriculture, and is a pollutant and is driving impacting on respiratory disease. I think there's the demand for ultra processed food is driving the intensification of animal agriculture, and yet the ultra processed food is burdening the healthcare service, and a lot of this is the politics, and everybody should have a right to healthy food. I know there's a right to food motion going through Parliament, trying to get through Parliament at the moment, but it's the right to healthy food that's going to impact in the long term, impact on us, impact on the healthcare service. You know, let's get a wellness service rather than a sickness service. And this accessibility to unhealthy food, and unhealthy food being affordable is just driving the health inequalities. So it's just an unjust service all around. But I think as healthcare professionals, we're in a really privileged and powerful position to impact on social injustice and move towards a compassionate existence that will be in harmony with nature, and will give everybody the right to a healthful life. I think you know, we need to allow freedom for all animals. We need to transform our diet. We need to improve health outcomes and impact on climate change. And you know, we can do that, and the power is certainly in our hands at the moment. And I think we're in a great position to be standing for animal rights and moving towards health for everyone.
Thank you, Hayley. I agree. Healthcare professionals are actually in a privileged position, and also because, you know, as healthcare professionals, people look up to you. You know, so your advice counts actually. And, you know, we all know Dr. Kim Williams says that, you know, there are two types of cardiologists: those who are vegan, those who are not vegan, and those who have read the data or something like that. Anyway, so I think once you know the science, you know the harms that animal products have actually, you know, can cause, you need to change your practice. And, you know, I worked as a pediatrician for a long time, and I kept telling parents, you know, you should give your children whole skimmed milk. You know, it is good. They need to drink cow's milk. And looking back, I feel so bad about that advice. And recently I spoke to Buvana. We were talking about this panel, and you actually, Buvana, you made a very good point about cow's milk. Do you want to share that with us?
Yeah, so I think the first thing is, we know that breast milk or breastfeeding rates in the UK are some of the lowest in Europe. We are right at the bottom. And we also know that socially disadvantaged women are less likely to breastfeed as opposed to, you know, those from a privileged part of the country. Milk per se is actually, drinking milk beyond infancy is a very novel behavior. Okay, it ranges anywhere between 8,000 years in Europe to just a few decades in Asia. So the Chinese and the Japanese never had milk traditionally. There's also a well-documented variability in digesting milk. We know that. And we know that milk is species specific. I mean, that's a no-brainer. And cross-consumption should definitely have some life history consequences. It just doesn't make sense. To put things in perspective, calves gain weight somewhere between 0.7 to 0.8 kilograms a day, okay, as opposed to the human child, which is only 0.02 kilograms per day. So you can see it's meant to make this little calf into a huge cow. It has 3 times more protein, cow's milk, 4 times more calcium than breast milk, and also more minerals except iron. Cow's milk is quite poor in iron. It's not surprising at all that it contributes to accelerated growth. Not surprising at all. It's got, you know, after all, it has the potential. And it is also one thing we must remember, that it's an unusual food with a bioactive profile and nutrient profile, which is not unique to milk at all. So if you look at breast milk is exclusively meant for the human infant. In fact, I tell you, the number of breastfeeding initiatives is pretty high in every hospital where mums deliver. They try to support this, and you, in fact, even the recommendation is that you don't introduce cow's milk to less than 12 months. So you know the kind of thing which goes around encouraging breast milk for the first 2 years of life. But then this very milk becomes a health food when you become 2 years old, which is really odd. How does that change? So at 2, suddenly you should be drinking 3 glasses of semi-skim milk. You should be drinking this. You should be having cheese. You should be having the other things. It just doesn't make sense if you think about it. And I think most studies say cow's milk gives you accelerated growth. The end height is really, you're taller than those children who don't consume milk. But that, again, one must remember that necessarily going on to larger adult sizes doesn't necessarily mean it's good for you. Because we know that early puberty, rapid growth in childhood, and also a rapid increase in height is actually associated with an increase in chronic diseases as an adult. So you see the difference? So the first 2 years should necessarily be something that you encourage and promote breast milk. And for some reason it becomes. So if you look at the obesity figures in children, and particularly I'm quite interested in this part of it, you know that 1 in 5 children are overweight or obese in primary school, which actually goes up to 1 in 3 in secondary school. And it was estimated by the Royal College by the year 2020, half the children would be overweight and obese. There was an interesting thing which came by the Parliament report itself, which says that closer you are to a fast food joint, more likely you are to be obese. And we know exclusively that these fast food takeaways sell animal products. We know that. Unless it's the occasional veggie burger for veganuary, we know that predominantly 99% of these are animal products. And there has also been a research paper from Scotland which suggests that children who have energy-dense food, particularly red meat as opposed to vegetables, are obese. While milk is classified as less energy-dense, you must remember that it has a very high saturated fat content. I'm saying all this because this has implications even as a child. A lot of times, chubby children, oh, they look so cute. But that's not necessarily the right thing because you know you're opening up a whole lot of things. And I can certainly see in my practice that we are having bigger and bigger teenagers who weigh 120 kilos. We have had to get ventilators from the adult side to ventilate this. This was unheard of. We never did 120 kilo children. And that's becoming, and that's necessarily the fast food culture as well as high sugar and all of, I mean, even though obesity is multifactorial, we know that the diet, part of it actually contributes to a substantial amount. The other interesting thing is that it is actually very cheap to eat unhealthy. We know that. So there was another very interesting thing which came out of the metabolic sciences department at Addenbrooke's, which said that if you want to hit your vegetable and fruit target, it is 17% more expensive to do that. While red meat consumption is 4% less expensive. And the fiber is, part of it is neutral, probably because lentils are cheap. Yeah, so that is the kind of, so it's expensive as a child, especially if you are from an economically disadvantaged background. It is. A McDonald's burger costs 99p, while a punnet of any season-specific fruit is £3. So this is exactly what we're doing. And I think we're doing a major disservice to children by this. And I say this because we definitely see that obesity is a new epidemic. And with even the Royal College of Pediatrics taking this on. And I think this is necessarily connected to our very high consumption of animal products. And finally, I believe children, on an average, there's another survey which said they have only 3. The maximum fruit and vegetable most children have is 3 a day. That doesn't even actually touch the target which they're supposed to be. And just 18 grams of fiber as opposed to 30 grams which children need, and more salt and more sugar. So this is just how it is. And we know that this profile is probably because of a lot of it fast food culture, especially with animal products derived. And this whole thing to drink milk, 3 glasses of milk a day, 4 glasses of milk a day, with a lot of things for something which you don't necessarily need. Yep. So, yeah. So
yeah.
all the more,
yeah, go on, sorry.
All the more I think that this is where I think as health professionals we step in. We know that we live in a very animal product heavy nutrition directed society where especially children, a lot of people, I've known vegans who wouldn't bring their children up as vegans because they are, I don't want to go against the social norm. And it ranges from you will be reported to social services to your child is going to die of deficiencies. These things just don't happen. Out of 100 parents, you see who starve their children, one of them would be vegan, and that's what is picked up by media. The 99 others aren't. But I think as health professionals, what we need to do is actually educate ourselves first. I say that because it took a lot for me to move away from traditional teaching of 3 glasses of milk a day to actually see that this nutrient profile in milk is not unique. If any other plant-based product could give it safely to a child, you could. And it took a long time. I think that's where we are. And ultimately it is, I think, it's absolutely related to animal rights as well. Human rights. Animal rights is human rights, if you think about it.
Yeah, I agree. Thank you. And you're right. We need to educate ourselves. It starts with us. And it is funny. I mean, when I look back, I think, why didn't I ever question, like you say, the first few months, no cow's milk, no cow's milk, and suddenly here you go. But I never actually questioned it. I just took it for granted. That's just the way it is, and we really need to educate ourselves before we can educate, other people. Now, Rosie, you mentioned that you worked actually with animals, you were working with them, and also you're actually the only dietitian here in the panel. So I want to hear your views, how do you see your role as a healthcare professional, with issues around animal rights and human health?
Thank you, Leila. Yeah, absolutely. So obviously my background is quite varied, and we've had some fantastic people speaking, covering the impact of meat and milk on human health and animal welfare and mental health, which I think Simon's going to go into as well. So I wanted to talk a little bit about some of the research that I've done on sustainable diets, which has really highlighted the environmental impact of animal agriculture and the direct and indirect impact of this on human health, which you alluded to at the beginning, Leila. So my experiences of working in animal behaviour ecology and then moving into human health and diet, and more recently researching the environmental impacts of animal agriculture for another project, has really opened my eyes to the fact that it is just all so connected. I used to think that my career choice completely did a bit of a U-turn, but it's all kind of come together now, and it is also connected. I think, we train in lots of different areas, we all focus on different things, but the connection between animal health and human health, and the fact that it's so intertwined with environmental health, damaging one is damaging the others. And I just want to state, something that the Eat Lancet report quote said, that food is the single strongest lever to optimize human health and environmental sustainability on Earth. However, food is currently threatening both people and planet. So it's the problem, and I feel like it's a huge part of the solution as well. And we're now going into what is called the Anthropocene, and this defines Earth's most recent geological time period as being human-influenced or anthropogenic. And this is based on overwhelming global evidence that atmospheric, geologic, hydrological, biospherical, and other Earth system processes are now altered by humans. And food influences and damages our environment throughout its journey, so from farm to fork to waste. Concerns for the world's food supply is at an unprecedented level now, and it's estimated that we need to double food production by 2050 in an increasingly constrained environment. Agriculture and livestock farming is the biggest contributor to greenhouse gas emissions of all food, and as well as things like deforestation, biodiversity loss, soil pollution, land and water use, and red meat and dairy as products of animal agriculture are the top contributors to this. In terms of greenhouse gas emissions, most emissions related to livestock industry are in the form of carbon dioxide, nitrous oxide, methane and ammonia, and these all add to the issues of global warming and things like acid rain as well. It's been estimated that a global halving of agricultural emissions could reduce mortality attributed to particulate matter by 250,000 globally and 52,000 across Europe. And we know that switching from a high meat diet to a low meat diet reduces individual greenhouse gas emissions by 39%, and this increases to 63% with a vegan diet. And meat production and milk as well is not very efficient. So if we think back to something like GCSE science, this relates to the energy that's lost at each trophic level. So globally, 77% of farmland is used for animal production, and that produces just 18% of the calories consumed. And this means that 23% of farmland produces 82% of the calories that we consume through plants. If we didn't have animal production, only a tiny percentage more, maybe 7% of the most productive land is needed to give us all the calories that we need. And this would help starving populations around the world. It would help to support the alleviation of world hunger. And it would leave 70% of land that's currently being used for animal production to, do things like rewilding, using it for human well-being. We've all heard of forest bathing and how the environment can have an impact on how we feel. And things like crop produce we could export to less productive countries. And it could also improve our badly depleted topsoil or generate energy as well. So as you're probably aware, forest clearing for animal agriculture also results in species loss. So and a staggering 137 unique species of plants, animals, and insects are lost every single day. And some other papers have quoted more than that. And that is a really scary figure. I think Hayley mentioned also water pollution as well. It's a major issue, particularly in developing countries. So this is caused by animal excrement, antibiotics, hormones, as we've talked about, fertilizers and pesticides. And there's now even research that's starting to look at the proximity of mass livestock farming on the health of the communities that surround them. So therefore, that's a more direct influence of poor human health resulting from animal agriculture. I think taking care of our environment is not just a benefit for the future. You know, it's not something that's nice to do so our grandchildren can see orangutans in the forest or tigers in the wild. It is absolutely vital to human survival. The planet's ecosystem is intricately interlinked, and the loss of even a single species of insect can have devastating knock-on effects for humans. For example, our bee pollinators. In the same way, I think we've mentioned also gas emissions impact on lung health, water pollution on disease transmission, as well as direct human loss of life with climate change from flooding, fires, sea level rise, changing crop seasons, and therefore loss of food productions in the community that rely on those things. And I also wanted to mention something that the Intergovernmental Panel on Climate Change reported in 2019. They said that there's a significant potential mitigation of climate change arising from the adoption of diets that are in line with dietary recommendations that are made on the basis of health. And these are typically higher in plant-based foods such as vegetables, fruits, whole grains, legumes, nuts and seeds, and lower in animal source foods, fats and sugar. So we know that sustainable diets are healthy diets. There is no downside to this. And this applies to everyone, but health professionals need to be aware of these issues. There was the One Blue Dot campaign released in 2018 by the British Dietetic Association, and this highlighted the impact of animal agriculture, and it aimed to help dietitians talk about reducing red meat and dairy with patients and clients, and also provide them with a toolkit to talk about food and sustainability. I believe this needs to be a key issue on the minds and in the structured education as well of health professionals, so that they can feel confident enough to talk about it in their own various fields of expertise. And I think we must remember that there is no human health or animal health without planetary health.
Thank you. Yes, when we harm the animals, the environment, we are harming ourselves in one way or another. Now, in the beginning, I said we are not really going to touch on the fact that animals are sentient beings, but at the same time, as healthcare professionals, we are always told we need to be empathic to the needs of our patients and clients. I forgot how many, lectures I had actually on the topic of being empathic in the first few months of being a doctor, because being empathic is very important. And Simon, you wanted to touch on that and also talk about the mental health consequences.
Yes, that's right. Thank you, Leila. So it's Mental Health Awareness Week at my son's school on Monday. This year, the focus being express yourself. And I'd like to delve into the connection between empathy for animals and empathy for fellow humans. I'm a GP, family doctor, practicing rural general practice in the southwest of England, and as I said at the beginning, I serve a largely farming community, and mainly livestock farming, meat and dairy, and gone are the days of old MacDonald and the small holding. Modern day meat production globally is now on a massive scale, and industrial livestock farms, more commonly referred to as factory farms, require industrial scale meat processing plants, or more commonly termed abattoirs and slaughterhouses. And I apologise if what I'm going to talk about some may find distressing. So you probably know the stats already, but 100 million animals are killed for meat in the UK every month, and 78 billion animals are killed globally each year, which is 10 times the world's human population. and very little is heard about the people doing the killing. Meat processing in the UK employs 75,000 people, 69% of whom are from outside of the UK, mostly Eastern Europe. And the British Meat Processors Association describes the job as a challenging environment. Well, I'll elaborate on that a little bit. It's obviously a very physically demanding job. It's high risk, even perilous. The work is fast-paced and repetitive, and there's musculoskeletal injuries galore. There's frequent severe accidents from dangerous machinery or frightened, distressed animals themselves, and limb amputations. Even death is not uncommon in this industry, but it's just not mentioned. Perhaps more worrying is the psychological demands. Most people enjoy eating meat, but many would have difficulty working in an abattoir, and few fully appreciate or are aware of what it entails and what is required to put meat on the plate. You've probably heard the quote from Sir Paul McCartney: "If slaughterhouses had glass walls, everyone would be a vegetarian." I think the psychological impact on workers is no doubt immense. Abattoir work has definitely been linked to multiple mental health problems. It has effects on families and society, which is very worrying. The disassociation and desensitization required to do the job, that is to kill upwards of 250 animals a day, by its very nature, workers are at risk of psychiatric disorder, and one could call it pathological sadism. It's very common for workers to display aggression similar to those in other lines of work, such as prison workers. And I mean, perhaps the aggression is necessary to get the job done. Slaughterhouse workers, in slaughterhouse workers, there's there's not necessarily a pre-existing predisposition to abuse, but it's the repetitive killing of animals, which is the first step, which desensitizes workers to further violence, which often is aimed at humans. You've probably heard the other quote: "As long as there are slaughterhouses, there will be battlefields," which is Tolstoy. The psychological term doubling is an interesting one, where an individual is compelled to create dual selves, a good and a bad self, and a job where you're unable to show weakness or express your feelings, even if your grasp of the language did allow it. It means that instead you bottle up your emotions, and there's a great risk that bad self, the one that commits unempathic work repeatedly, can spill over and affect personal lives, communities, and loved ones. The term cognitive dissonance is another often used to describe someone where in a position where their morals and their actions do not align, and the mental acrobatics required to maintain the good self and a moral compass, whilst the bad self mechanically ends lives for hours each day, causes significant psychological stress. The name Perpetrator-Induced Traumatic Syndrome, or the acronym PITS, which is perhaps appropriate, is often applied to what is suffered by slaughterhouse workers, and this is a condition where the symptoms are similar to more widely known PTSD, post-traumatic stress disorder, but unlike PTSD, PITS, PITS, is where the sufferer is causing the traumatic situation to another, and where the sufferer of PITS is a causal participant in the traumatic situation, and they are the direct reason for another being's trauma. Sometimes similarities drawn to other studied, maybe more studied groups, such as Nazi doctors and executioners. Living with the knowledge of your actions and that it causes symptoms of and behaviours commonly seen in other stress disorders, anxiety, depression, substance abuse, and dissociation from reality and emotional numbing. Many workers report recurring nightmares, feelings of shame, fear, emotional detachment, social rejection, isolation, and violence. It's perhaps not surprising there's high crime rates, especially of violent crime and sexual crime amongst this population. There's particularly high rates of domestic violence and high rates of suicide. Actually, the pandemic has also identified that in this population there's a high risk of spreading and contracting COVID-19 due to working and living conditions. And of course, rarely does anyone choose to do this work. For many, employment options are limited. Perhaps desperate individuals, migrant workers whose access to language courses or adult education and training is limited. It's often minimum wage and a job taken as a last resort. They may even be moonlighting in other jobs. It's exhausting work, it's long hours, and it's a high-risk environment, and those risks pose a significant impact on not only physical but mental health. So I just wanted to finish by saying maybe that this is animal agricultural industry's third impact. We've talked about the impact of on the health of the planet and on ourselves. Obviously the welfare of animals themselves, but few appreciate the impact of the animal agriculture industry on the human psyche. My work as a GP is obviously to help people live long, healthy and happy lives. Bringing lifestyle medicine into this, one of the four key principles of pioneer Dr. Dean Ornish's work is to love more, and that's the importance of loving oneself and others in building social connection and maintaining healthy relationships to make you healthier and happier human being. Perhaps the COVID-19 pandemic, in particular, our response to it has in some ways helped us come together and realize the importance of love, kindness and compassion amongst human beings. And I would argue that this starts with kindness and compassion towards all sentient beings, including those in the animal kingdom. Increasing our kindness and empathy towards animals surely translates into greater kindness and empathy towards each other as fellow human beings, and creating a happier and healthier human population that will certainly make my job easier as a health professional and more rewarding and satisfying. So
Thank you, Simon. Yeah, that was quite heartbreaking, as people have been commenting, horrific and heartbreaking. Yes, it is actually, when you look at what happens to those people who are actually in those, we just say factory farming and animal agriculture, but there are actually actual people doing the work, and what happens to those people. Thank you. Now, I'm aware it is 4 o'clock. We have run out of time, but we have Dr. Aysha Akhtar with us today, and she's an expert in vivisection. And I would like her to tell us a little bit about it and why it is actually not effective and what we can do.
Right. So what we've heard is, it doesn't make sense, but what we've heard is that by our treatment of animals and the suffering we cause animals, whether by directly eating them, whether by the environmental and climate impact that stems from factory farming, whether it's by the viruses, bacteria, antibiotic resistance that comes out from factory farming, whether it's from the viruses that emerge from the wildlife trade, what we do then, so we cause all the suffering in animals. That ends up causing suffering in us, causing diseases in us. And then what do? We go and cause further suffering in animals by experimenting on them to find drugs and vaccines to treat the very diseases, many, I would argue, most of which could have been prevented if we treated animals as sentient beings, if we treated them with kindness. And so when you think about vivisection, animal experimentation, it's another link to how we treat animals directly impacts us, because what we are learning more and more is that animal experimentation is not only not good for animals by any means, it's also not good for us. Statistics have been showing this again and again, and the scientific literature is showing this again and again. Largely, when we look at animal experimentation as a whole, what we are finding is that animal experimentation does not reliably predict what we're going to find in humans. It does not reliably predict whether a drug or vaccine is going to be safe or effective in humans. It does not reliably replicate and help us understand human diseases and human health. And it really showcased, this is really highlighted with one statistic that has been, I think a lot of people have heard again and again. But at least in the US, and I think this is a statistic that is pretty representative throughout the world, what we know is that between 90 to 95% of the drugs and vaccines that have passed through animal experimentation and other types of testing, but animal experimentations are considered pivotal studies in this process, 90 to 95% of the drugs that were found to be safe and effective in animals end up failing when tried in humans. They fail. Most of them fail because they are unsafe or ineffective in humans. So what we're seeing is a 90 to 95% failure rate of animal experimentation. Now I ask you, do you know of any other industry in the world where we accept such a ridiculously dismal failure rate? I mean, can you imagine if you were to board a plane and the pilot said that, ladies and gentlemen, we have about a 5% chance of landing safely at our destination. And I guarantee everyone would hop off the plane immediately, and we would demand a total U-Haul of the entire, airline industry. But that doesn't happen when it comes to the very drugs and vaccines that we are injecting or ingesting or in other ways putting into our bodies. And so, we do know that not only do we need to move away from animal experimentation because it's ethically just horrendously cruel to animals, but it's cruel to us. We know that animal experimentation largely harms humans because if you think about this, for all those drugs, all those failures in drug development, that's just the tip of the iceberg. That each failure is a failure that also includes years, sometimes decades of research, resources, scientists' time, animals' lives, money, and in the same time, we have patients who are waiting, their lives are in the balance as they're waiting for drugs and vaccines that are going to work in them. And so for multiple reasons, we truly need to move away from the use of animals for experimentation. So the flip side when we think about the ethics is, not only is animal experimentation harmful to animals, but is it harmful to humans? And the evidence is increasingly saying yes, a resounding yes. We absolutely need to move away from animal experimentation. No matter what we do, a rat's biology, a dog's biology, a monkey's biology, even though there are similarities across all species, ultimately it is the differences between each species that is causing problems. And that's leading to the high failure rate in drug development. And so if you can just give me a moment. So if I can sort of summarize in some way what we're seeing here, when we think about all the different ways that our lives are impacted by how we treat animals, our health is directly impacted by eating animals, which leads to high risk of many chronic diseases, heart disease, cancer, strokes, obesity, so on. It's impacted by the climate change that results from factory farming. It's impacted by the environmental damage that results from factory farming. It's impacted by the wildlife trade, disruption of ecosystems that leads to the emergence of new viruses, and factory farm that leads to the emergence of new viruses. It's impacted by using animals in experimentation that leads to incredible high failure rates in drug development. And so you can think of all these, and of course, as Simon was mentioning, violence towards animals is very much linked towards violence towards humans. So there's very much a psychological impact in how we treat other animals. So you think about all these different connections. And what's been very frustrating, I think, for all of us here is that largely the healthcare field has failed to really address these connections. And that's why we're here today. And I think it's really important that we have more discussions like this to really showcase how very much human health, human protection, human rights is linked to animal rights. And I would also go one step further. Historically, public health and doctors have been at the forefront of many social justice movements. When you think about children working in factories, women rights, Black rights, you think about minority rights, public health specialists and doctors have been at the forefront of so many of those campaigns. Why aren't they at the forefront of the animal rights campaign as well? Why aren't they at the forefront of this social justice movement as well? And so I would really, if there are any other healthcare workers listening in today, I challenge you to really think this thoroughly and say, and ask yourself, do you want to be a laggard in being on the forefront of this next social justice movement, or do you want to be a leader? And I'll stop.
Yeah. Thank you so much. That was very interesting and insightful. I like the analogy you made with the, planes. You're right. And, not only are they ineffective, they are, harming animals, and we should just stop them. So I really want to thank everybody, for taking time to come and, talk about this very important issue. I really enjoyed it. I learned a lot. And I hope I didn't see any questions really in the comments. And I know that we are over time anyway. Tim, are you still there? Oh, yes,
they listened intensely. What a fascinating conversation. So many good subjects touched on them. I won't run through them all, but I was really, really grateful to hear that this is now within the healthcare professionals, so many conversations about this. You may laugh, but I remember 30 years ago standing up to do a talk in a squatted church in Kentish Town to 200 people about the benefits of plant-based essential fatty acids. I'm glad none of you were there because I didn't really know what I was talking about, but I knew that it was an important subject to talk about, and that, I remember thinking, I wish there were some people who actually knew what they were on about, and properly done the research, rather than this sort of layperson bravely standing up. But I remember also people thinking, oh, wow, they're all really impressed. But it was just such essential information, the benefits of plant-based diets for health. And to hear now that animal rights is becoming into our language, is becoming normalised. It's becoming an understood position, and to hear that reflected, and I agree, it's really important that healthcare professionals become leaders and really head up. We've got a tremendous opportunity there, people especially now listening. And thank you, all of you too, because I know you all, a lot of you work on the front line, or you've got colleagues or friends who do, and you've really witnessed firsthand this pandemic in a way that perhaps people like myself have been lucky enough to sort of just, sit back and not have to do that. And I know how deeply that's impacted on the communities you're working. So thank you again, and maybe have more conversations. I think they're tremendously valuable to help people latch in and listen in and be inspired. And even so, sometimes they're just small sound bites. They inspire, and they break down barriers, and they allow people to have these conversations. So that's the value, particularly. It's been brilliant. It's been brilliant. I can't thank you enough. I know we've overrun. I think there are some questions actually in the comments. You can go on Facebook.
If there is ever going to be a cruelty-free vaccine, a COVID-19 vaccine.
There's questions you can answer later. I know in the comments section you can go onto Facebook and have some conversation.
Yes, we will do that then. That's fine.
But also to say that we're going again in March. We've got a whole health and then a whole fitness day. We're going to devote the whole days to these areas. So, you're very welcome, all of you, to come back and join us. Or if you've got something you'd like to add to, or perhaps do a whole presentation on, or initiate a further, more in-depth conversation, because we don't always get the opportunity to do that here, then be very welcome. And yes, if you've asked comments, or in the comment section, be on Facebook later. And of course, you can
I'll
watch
have a look.
this.
Thank you.
Yeah, you can watch this on vegfest.co.uk later. Please do share. Very welcome. It's a free asset. Thank you once again, Leila. Thank you especially.
Thank you, team.
And
Thank you.
if you'd like to say goodbye.
Thank you, everybody, for joining us.
Thank you very much.
Bye-bye.
Thank you.